Hello everyone, welcome back to my channel. In today's topic, we'll be talking about history taking. History taking is a very important and crucial aspect of your visit to the hospital as a pregnant woman. During history taking, there are so many histories that your midwife or your health attendant need to know about you, ranging from your family history, medical history, surgical history, your lifestyle, everything about you, because that will help your health worker to manage you. We are starting with obstetric history slash menstrual history. During your first visit, they will ask you when was the last time you saw your menstrual period. That is your LMP, your last menstrual period. We're talking about the day it started. I mean, the last menstrual period you saw before you finally realized that you are pregnant. So, which day did it start? We are going to note that down. Okay. So now, why are we asking you about your menstrual history? I mean, your last menstrual period. The thing is that some women have 28-day cycle. Some women, their cycles are lower than 28. Some women, their cycles are above 28. It's going to help you to calculate the expected date of delivery. One. Secondly, it's going to help you to know the gestational age of that present pregnancy. Gestational age meaning that how many weeks is she when she presented to the hospital for the first time. Now, coming to the obstetric history. Obstetric history, they will ask you how many children do you have, how many of them are alive, what are their sexes, like are they male, are they all male, are they all female. That will help your management. Then, like your previous child experience. For instance, now when they ask you how many children do you have, how many children do you have means how many children do you have alive. So when they ask you how many children do you have alive, they're just trying to ascertain some things, ascertain the number of pregnancies you've had, number of them that is alive. From there, we'll go on and ask you, if they are not alive, what happened to them? What were your experiences during the time of their delivery? Then the second one is how many pregnancies have you had? This is where some women find it very confusing. Yes, let me just use that word, confusing. So women find it confusing. How many pregnancies you have, meaning that how many times have you gotten pregnant all through your life? Both the ones you got before you got married, the ones you miscarried, the ones that you aborted, all of them all together is what, if you can remember them, all together is what you want to know. Some women, during their when they were before they got married, so they must have had some series of abortions. We are not asking you because we want to know your past. We are not doing anything with that. So we just want to know how to manage you. Whatever question we are asking you is to your best interest, is for your own good, to know how to manage you. For instance, let me give you an example. If you have had more than 4 or 5 abortions, it's an indicator that this woman is on a special care. In the sense that if you have had more than 4 abortions, and the pregnancy you presented with is the 5th one, which means that is the 5th pregnancy, and there is every tendency of postpartum hemorrhage, because your uterus is a multigravid uterus. Your uterus has harbored more than 5 babies as at your time of presentation. So it's going to aid your health worker. Watch out for postpartum hemorrhage. Watch out for maybe abruption placenta. Watch out for so many things during your care. Okay. Now, the next history that we're going to talk about now is medical and surgical history. Medical history, like diabetes mellitus, pyelonephritis, high blood pressure, and then some psychiatric disorders. They will ask you all these questions in the hospital. They will ask you, are you diabetic? Have you had any sugar issue before? Are you hypertensive? Maybe during this pregnancy, before the pregnancy, or any time in the past. Has there been a time you were diagnosed of hypertension or diabetes. It is going to aid your health worker, your midwife, or your doctor in your care. Is all about you. That is to your own best interest. They will ask you your surgical history. How many surgeries have you had? Okay, it can be any surgery at all. It can be breast surgery, appendectomy, that is appendix surgery. It can also be cesarean section, sapingectomy. Sapingectomy is maybe there was a time you had ectopic pregnancy and one of your tubes was removed. So all these, if you can remember all of them, please, it's very important you talk to your health worker about all of them. That is going to help in the care that the health worker will render to you. Then psychiatric disorders. Has there been a time you were depressed before this pregnancy? Especially some women that were TTC mothers, like they were trying to conceive before the present pregnancy, and it has taken them like 5 years, 10 years, or 15 years to conceive. At a time, there is that period that the person will be depressed. The person will be like, why am I not getting pregnant? What is wrong with me? The person will be depressed, the person will be having some suicidal thoughts. So all these things are very important. If you have had something like that, please, it's very important that you talk to your health worker, talk to your midwife, talk to your doctors about all this during history taking. Even if that health worker did not ask you, please speak up. I was depressed, I was this, I took some medications, I saw a therapist. The therapist helped me out of my depressed state. Just be open, talk to your health worker. Do you understand? You are hypertensive already before you took him. Then when you now took him, pregnancy presented its own hypertension. So that is the reason for all this history that we are taking. Then we'll also talk about how many uterine surgeries have you had, like fibroid surgeries, cesarean section. But why I am hammering on this is that there was a case that happened in my clinic where I work. So this woman, she had two children, and the two of them, they were through surgery, through cesarean section. She had them through cesarean section, and she was pregnant for the third time, and she wanted to push. She wanted to have a vaginal delivery after 2 previous cesarean sections. And the funny part is that she didn't come for antenatal. So because all this history we are taking is actually during antenatal that they take this history. So, but this one didn't come for antenatal. She presented to the hospital when she was done, like when she was there for delivery, and she was already having contraction. And during the history taking, when she presented, she did not tell the health worker that was attending to her that I've had this. Okay, luckily for us, I was on duty, and I was like, so your first, as I was there, and I asked her the question, so your first and second pregnancy, you had a vaginal birth? She said no. Sorry, that it was cesarean section that she had. I said, okay, so what is your plan? As in, you've had 2 cesarean sections here, so what is your plan? She wants to have a safe delivery. That was what she said, that she wants to have a safe delivery with the present pregnancy. That is the third one. How possible is that? After 2 previous CS, after 2 previous cesarean sections, you don't want to have a vaginal birth. She even said she wants to have a safe delivery. Like in this part of the world, what they call vaginal birth is safe delivery. For the record, please, as long as you are alive, your baby is alive, that is a safe delivery. It doesn't matter the method, whether it was vaginal birth, whether it was cesarean section, that doesn't matter. As long as you are alive, no complication, your baby is alive, complication free, that is safe delivery. Okay, that is safe delivery. And if you have had like a fibroid surgery before, or cesarean section more than once, please, you're no longer eligible for vaginal birth. You are not eligible for vaginal birth. So these are the things you need to talk to your health worker about. These are the importance of history taking. We are trying to save your life, okay? We are trying to save your life and adopt the best available care plan for you. That is what we are trying to do. It is not to the benefit of the health worker, okay? Then another history is family history. Family history of blood pressure. Your mother, your father, do you have any sibling that is hypertensive? Do you have any sibling that is diabetic? Was your mother diabetic, or is your father diabetic? Is any member of your family diabetic? Is there any history of twins, maybe from your or from your husband's side? You understand? So these, or even triplets, if there has been any of these, we are also going to mark that. We'll mark it out. That's okay. This woman, you should watch her out for this. The father is diabetic, so you should watch her out for gestational diabetes. The mother is hypertensive, so we should watch out for all this during your management. Then another thing, is there any coagulation disorders? Like some people, when they have an injury, they start to bleed, and it takes time for the bleeding to stop because their clotting factor, they have low clotting factors in their blood. Yes, so they are going to ask you, is there any of your family member with such history, or even you in the past? The another one is sickle cell anemia. Is any member of your family suffering from sickle cell anemia? Maybe your cousins, your mother, or your father. Then the last one is lifestyle, like smoking, alcohol intake, the complications surrounding smoking and the alcohol intake, and the effect it's going to have on your child. You understand? And the health worker is going to advise you accordingly. Okay, so we are coming to the end of this video today, and please comment below. Tell me your experience during your pregnancy, during the time that you are taking your histories. Tell me, were you comfortable? Were you uncomfortable? I would like to know in the comment section. Thank you. Bye. See you in the next video.